What if one of the biggest problems with postpartum psychosis is that we still don't understand it well enough? And I'm thinking about this because of the Lindsay Clancy trial that's happening right now. And I want to be careful here. I'm not making a claim about Lindsay Clancy's diagnosis or what happened in that case. That's for the court and the experts involved. But the trial has brought up something that I feel deserves a bigger conversation. As a woman and therapist in training, currently doing clinical hours and learning about diagnosis and assessment, this is the kind of case that makes me want to dig deeper. Dear future therapist, what's happening in the Lindsay Clancy trial is exactly why we need to keep learning beyond the textbook. Postpartum psychosis is a real severe psychiatric emergency, but it's not a distinct diagnosis in the DSM. Instead, the DSM addresses the peripartum period through a specifier for depressive, bipolar, and other related disorders. And peripartum means during pregnancy and shortly after giving birth. And this is where it gets really interesting. The DSM specifically says that peripartum mood disorders can present with or without psychotic features, noting it's most often associated with postpartum psychotic episodes involving things like command hallucinations to kill the infant or delusions that the infant is possessed. So the DSM absolutely acknowledges that postpartum psychosis exists, but it doesn't give it a distinct category. And that distinction matters because psychosis isn't something that you can necessarily identify with a standard depression or anxiety questionnaire. Someone experiencing psychosis may have hallucinations, delusions, severe confusion, disorganized thinking, profound insomnia, or a significant break from reality. And they might not have the insight or ability to accurately report what's happening to them. Not to mention, all of those symptoms are extremely stigmatized in our culture to this day. So recognizing these symptoms often requires clinical observation, direct assessment, or information from friends or family members. And this is why knowing what to look for matters. Because when a condition is relatively rare, severe, difficult to assess using standard self-report tools, and doesn't have its own distinct diagnostic category, we have to be especially intentional about recognizing it. And there are plenty of researchers and experts that are actively arguing that postpartum psychosis should be its own diagnostic entity. So maybe the conversation shouldn't just be about one trial. Maybe we should be asking where the gaps are when it comes to understanding these symptoms, how we recognize it, assess it, train clinicians to identify it, and how we can make sure women who are experiencing it don't fall through the cracks. And I'm curious, are there other therapists or therapists in training who are following this case? I suspect there are. Or have you ever worked with someone experiencing postpartum psychosis? Let me know in the comments.